Ontario has now surpassed 1,000 daily cases of COVID-19. That is a record daily high in the province. So what do we make of the surge and what needs to be done to get it under control? For more on this, we're joined by infectious diseases specialist Dr. Isaac Bogoch. Doctor, always a pleasure to see you. Thank you so much.
My pleasure. Great to chat.
When you hear those numbers, what goes through your mind right now? What do you attribute it to?
Well, in all fairness, we know those numbers were climbing, and over 1,000 cases is certainly a milestone. But quite frankly, it's not a lot different than the day before when we had 900 and something cases. But certainly the 1,000 number really raises a lot of eyebrows. Having said that, it's been about 2 weeks since Thanksgiving. It certainly could have been related to activities on Thanksgiving, and we might be seeing a spike related to that. On the other hand, it's kind of hard to know. And we've only known that the major restrictions in Peel, Toronto, Ottawa, and later in York were really imposed about 16 or so days ago. And there's always going to be a lag time between when those restrictions are imposed and when we see the outcomes of that. So this might actually just be the expected rise in cases in that window period between when restrictions were imposed and when we start to see any changes. So quite frankly, I think the next week and the 2 weeks ahead are going to be critical to see what direction we're headed in.
Yeah, that was kind of my next point, because obviously every day is important. But as we look to, past the threshold, as you mentioned, this is really the indicator of where things go. Are you optimistic, given the trajectory? Are you optimistic at all that we could see it slip back?
Yeah, honestly, I just don't know. It's really hard to tell because we have some restrictions in the number of cases that we're doing in Ontario based on the change to registering online to get a diagnostic test. There's some shreds of surveillance data that may have tiny arrows pointing in the right direction. So there's some evidence, like tiny bits of evidence saying maybe things are going to get better in the next week or two. Others, maybe they're not going to get better in the next day or two. Quite frankly, your guess is as good as mine. I think it's very challenging based on the data that we have available to predict how the next couple of weeks are going to go.
Now, there is talk of possible restrictions in a number of other regions, Halton and Durham. To give you a sense of the numbers in Durham, for example, a little more than 50 over the weekend. Is that enough, do you think, to call for a lockdown or at least more restrictions going back to stage 2?
I think the provincial health authorities and the provincial government are going to look at that extremely closely. And what they're going to do is they're going to look at those numbers and the trend over time, and they're going to basically end up deciding if that is significant enough that they need to put on this modified stage 2 restrictions to those areas. Now, these are neighboring areas to hot zones. It would come to nobody's surprise if they did do that. I just am not entirely sure if they've met that threshold, whatever the threshold is that the public health authorities are looking at. I'm not entirely sure that they've crossed that threshold. But again, the province has shown that it can pivot and it does impose public health restrictions where they feel necessary, and it lifts public health restrictions when the time comes as well. So I think they'll adapt to the local circumstances. I'm just not entirely clear if they've reached that threshold to reimpose this modified stage 2.
Now, if you recall, back in the spring when it came to enacting these restrictions, the argument was, at least mainly, so hospitals were not overwhelmed. How are we seeing them fare this time around?
So far, we're doing okay. But of course, we can't continue along the current path without having some negative impact. So right now, I think most hospitals in the hotspot regions are seeing cases of COVID-19. Certainly my hospital is. We didn't have a COVID-19 unit for a period of time in the summer, and now we had to sort of dust that off and refurbish our COVID-19 unit, and we have patients admitted to hospital. And there's a growing number of admitted patients to hospital throughout the province with this. If we continue along this path of 1,000 new cases per day, we will see a growing hospitalization. This will put pressure on our healthcare system. So I think it is important to obviously curb the spread of this infection in community settings to avoid that eventual rise in hospitalizations. We've got to take care of it now.
All right. We always appreciate your insight and your time. Thank you again, Dr. Isaac Bogoch. Thank you.